Don't leave the room. There are another 10 minutes. I know we cannot catch up with such an audience and such a panel here, but this is kind of the closing ceremony. But it's not really a closing ceremony. It's the beginning of a new era. So Antoine has been president for 1 year. That's the tradition in the World Health Summit. And there's a new president coming in, and that is Hélène Bourgelis from Canada. And yeah. And your applause shows that you all agree that Hélène is a wonderful president. And and it fits on Girls' Day, we have a female president. Now, I've been told that one of the traditions in the World Health Summit is that the past president can kiss in the new president. But after the discussion, I'll ask Hélène to kiss Antoine out of presidency. Okay. So Antoine, that's it. But to assure you, I mean, there's some continuity in the World Health Summit and the M8 Alliance. And so we have a tradition that the incoming president is a member of the Executive Council, and the outgoing president remains on the Executive Council, so that we maintain the experience which you have acquired during the years with the World Health Summit. Now, what do we next?
The declaration.
The declaration. All of you know that the summit comes to an end. And the summit is, as some people say, is not just talking, and networking among male and female and equal opportunity, but it's also about action. And there are several aspects. One is that the M8 Alliance itself of academic health centers. There are 24 centers around the world, from the Americas to Asia and some in Europe. And the M8 Alliance itself has an action plan, just to mention a few. One is education. Education is the best vaccination and also good for gender equality and everything we have discussed. It's education, medical education, improve public health, global health in the medical schools, but also education of population in kindergarten and in primary school, and so on. So these are very important topics. Another topic, for example, is a 15 million grant, which has been given to one of our members, the medical school in Sao Paulo, on Zika and other epidemics, and it's a worldwide grant by the European Commission, but on a worldwide scale, to fight epidemics around the world and build up infrastructure networks so that we can cope with it. So this is the M8 Alliance. The World Health Summit itself is organizing, after each summit, a World Health Summit M8 Alliance Declaration 2016. And this is actually now the task of the three of us to present what the M8 Alliance extracted from the workshops, from the discussions and their preparation. And this is a very short 5-minute presentation. And we start right away. No, there's another one first, I think. Yeah. So this is the declaration, closing ceremony, and then comes the next one, and that is, I can't see it very well here, we cannot accept that health becomes a battlefield. This has been in various discussions, and you may have realized that it's not only in Syria and in Yemen. In other places, health institutions, including primary care institutions, hospitals, are being bombed, are being attacked to destabilize regions. This indeed is one of the points which we not only can accept, but we really have to fiercely fight. This is one of the very important points. And now comes Elaine with number 1, empowerment of women.
Yes, so Antoine and I will do this as a duet. So number 1 is empowerment of women and girls. So we're calling for policies which will increase women's life choices and the right to modern family planning. So, and also the ending of gender-based violence and greater recognition of the contribution of women as paid and unpaid health workers.
So the second message of the M8 Alliance in this declaration is a right to health of refugees and migrants. Yes, this one. You can see the call for. We saw during this summit that there is still a substantial lack of data in the field and the need of research, need also of education. And what has been pointed out is the rights of those who are displaced today are really poorly protected in practice. Also, it has been mentioned at several occasions, the gender issue play a significant role in this problem. I have to say again here, healthcare is not a target, is not a battlefield. So the next one is also regarding the resilience and global health security. Why did we add the term resilience to the global health security concept? Is that, of course, we do agree and concur about global health security, but within the frame of solidarity. And we can see with this devastation of the Matthew hurricane in Haiti that it is not a security issue, a global health security issue, but it needs our solidarity, and we should not forget our solidarity and sustainability in these questions.
Yes, so the fourth item of our declaration regards antimicrobial resistance. There needs to be a significant effort to develop new vaccines and new antibiotics and antivirals. We have to avoid the use of the unnecessary use of antibiotics and implement a One Health approach. And those who really need antibiotics need to have access to these antibiotics. À toi, Antoine.
So the fifth point is about investment in research, development, and health innovation. We have noted, underlined, discussed about this enormous potential of innovation in healthcare for improving global health. We want high-tech, but we want high-tech low cost. We want affordability in innovation. The other point is when we are thinking about innovation, research in health, in global health, we are not only talking about tech, we are also talking about financing, about policies, about management, about all these soft innovations which also need our research, development, and attention. The floor is yours now.
So now it is to me to invite you to the 2017 Regional World Health Summit. The topic will be health and healthcare delivery in a diverse society, in a pluralistic society like Canada is and many other countries in the world. So this flower shows you in the center the main topic. On top, there will be 4 themes. Above in yellow, new frontiers in medical treatment is one of them. So global challenges in viral infections, diabetes, antibiotic resistance, and this thinking about the underserved patients. Second, in pale green, health and healthcare delivery for specific groups. So we are thinking about the First Nations in Canada and in many countries, the indigenous populations who were there before we came to the New World, and also migrants. In green, in the bottom, environmental, social, and cultural determinants of health for specific groups, such as people with addiction, and again, indigenous people. And lastly, medical education for optimal health care. So not just physicians, but also from other health professionals. The evolution of the role of patients with regard vis-a-vis health professionals will be one of the topics. Also, major advances in accreditations of the different medical schools, and also a very important session, a session planned by and for the students. So this was the general topic. 95% of the speakers are already on board. Joanne Liu, who is president of Médecins Sans Frontières, will be the speaker for the inaugural address, and one speaker in each of these areas. The best speakers we could find in the world, and if they were in Canada, we got them. So this will be held May 8th and 9th of 2017 in Montreal at the Palais des Congrès. Why 2017? Well, next year is the 150th anniversary of Canada, and it is the 375th anniversary of the city of Montreal. So we really want to welcome you to Montreal, and starting October 20th, you can register for this meeting, and just outdoor you can get a small book retainer. I don't know how you say signé in English anyway, but flyer. So a flyer if you don't want to go on the web. So we truly welcome you in Montreal, and we will be back to Berlin next year, and thank you so much, Detlev.
May I now ask the Montreal team to come up stage, and may I ask the Geneva team to come up stage, and you can start applauding already, and may I ask the World Health Summit team Berlin to come on stage. The World Health Summit team. Everybody on stage. And this is the moment to say thank you to all of you. I think, from my point of view, it was a wonderful meeting. Thank you. Without you, this would not have happened. And we are looking forward to Montreal. And thanks to the team in Geneva and in Berlin, and the supporting team who organized everything. I think everything went smoothly. Thank you very much, and bye-bye, and see you in Montreal. Okay, this now really concludes the World Health Summit 2016. Okay. Take you in the middle here. Elaine. Tarek, yeah.
I forgot to mention. I didn't even mention you there.
Warum ich stelle es einfach mal.